Another question, Dr. Islam. I have irritable bowel syndrome. What are some natural treatments for that? Okay, I love this question because there are some natural options we can give patients when it comes to IBS. Now, I warn people, for some people, the natural approach is not going to work. Not everyone responds to dietary changes. Not everyone responds to herbal treatment. Not everyone responds to more of the complementary alternative medications. Some people need medical therapy. Some people need other options. But here's what I recommend. For a lot of our patients, sometimes we start off with ginger or peppermint. Ginger or peppermint helps to soothe the gut, help to relieve pain, help to relieve nausea and bloating. It's a very effective and natural way, and it's now part of the guidelines to help treat IBS. Another option that we recommend, option number 2, is actually cognitive behavioral therapy, or CBT. CBT works. It is effective. It is amazing. It has such great clinical benefit when it comes to irritable bowel syndrome. And we have licensed therapists that actually can help us to manage what's going on with the pain. And my goodness, the effect is amazing, and it's very natural, and it works really, really well. Option number 3 is gut-directed hypnotherapy. Yes, we actually do hypnotherapy for your GI tract, and we're seeing more and more evidence that this is playing a significant role in improving gut pain and gut issues as well. Lastly, there's also some dietary options we recommend. For anybody who has diarrhea or bloating, I always recommend cut off all dairy. Eliminate dairy. You'd be surprised how many people don't realize that they have dairy intolerance. Number 2 is that I also recommend for you to stop using sugarless gums. Sugarless gums have artificial sweeteners and sugar alcohols that can make gut issues a lot worse. If you're having bloating and diarrhea, that's another thing we try to eliminate. And lastly, the best diet that we know is our 2 main diets. Number 1 is a plant-based diet, and number 2, a low FODMAP diet. And sometimes I combine the 2 into one diet to help out with gut issues, and by far, this has the best clinical evidence to help treat IBS naturally.